Hi, I'm Mary Ann Smith, and I'd like to talk with you today about age-friendly and dementia-friendly social movements. The goals for today are to briefly describe age-friendly health systems and 4M's care, age-friendly communities, which is related but different, and dementia-friendly communities. What I'd like to do is review similarities and overlaps because these terms get used a lot, but we may not always understand what the intention is. The other thing I'd like to emphasize is how important it is for each of us to take an active role in making change. So, age-related social movements are incredibly important. Just like other very large social movements, like the civil rights movement or women's rights movement, it takes a lot of momentum from a lot of different people to actually change attitudes and daily practices. And when we think about age-related, we are trying to encourage and advance the very best practices in the care, treatment, and just general socialization and well-being of older adults. We can change our ideas and our practices in a way that makes life easier and better quality for older people. The two main themes that have come out in the last couple of decades are being age-friendly, and that implies the age-friendly health systems that provide care and treatment, and also age-friendly communities. And the other main theme is being dementia-friendly, and that flows into dementia-friendly communities. The age-friendly health system social movement is co-sponsored by John A. Hartford Foundation, Institute for Healthcare Improvement, and healthcare systems, hospitals, outpatient clinics, and long-term services across the country. Please do visit the website here to learn more about age-friendly health systems. And also, please do be aware that we have a 7-part series about being age-friendly that relates to the 4M's in care and treatment of older adults. So the age-friendly health systems movement is really featured here in the photograph, or the screenshot rather, of the guide that talks about how we can be more age-friendly in our systems of care and use the 4M's to guide care of older adults. The ultimate goal is to achieve better health care for older people, reduce unwanted care and treatment, and certainly reduce risks of harm, reduce fragmented, burdensome care, and focus on what matters most to older people. So an age-friendly health system, by definition, is where every older adult gets the best possible care, experiences no health-related harms, is satisfied with the health care they receive, and value is optimized for everyone. The age-friendly healthcare system addresses 4M's. What matters most to the person, their medications, mobility, mentation that includes dementia, delirium, and depression. And the 4M's is a framework, a shift in how we provide care to older adults, not really a program. There are lots of really good reasons to use the 4M's framework. It is a best practice across a diverse group of healthcare settings, meaning that it works no matter where we put it in place. It focuses on the person, not the disease. And it also focuses on the person's quality of life, not just adding more treatments or transferring the person to an acute care setting for additional care and treatment. It starts with asking what matters most. And in that context, we want to know and align care with each person's specific health outcome goal and their care preferences. So we ask the older person to identify their health priorities, and then as clinicians, we translate those priorities into care options for that person, highly individualized. We also think in the context of what matters most, not just about health care, which is a piece of it, but it's how health care interacts with life and living, what gives us joy, happiness, meaning in living, how it impacts our actual health, our ongoing health concerns and conditions. So what matters most is the intersection of how we live, what's important to us, what our health conditions are, and then how we get treatment and care for those diseases and conditions. The interactions between the 4Ms are really critically important. So we start with what matters, and then we think about medications and use age-friendly medications that don't interfere with doing what matters most to their older person or their mobility or mentation. We think about their mobility, ensuring that the older person moves safely every day to maintain function and do what matters. And certainly we think about their mentation. How can we prevent and also identify and treat dementia, delirium, and depression across care settings? There are critical interactions, as I said before, among the 4Ms. The question of what matters most to the older person is the driver, but we're always thinking about how do medications influence mobility, how does mobility interact with mentation, everything interacts with one another and ultimately circles back to being able to do what matters most to the older person. Age-friendly health systems really are on the rise throughout the country. The initiative started in about 2017, and this slide is from a program that was provided at the American Geriatric Society meeting in 2019 that demonstrates that age-friendly systems have been adopted in many states and many healthcare systems throughout the country. We're hoping that you will consider joining that important social movement. So the 4Ms work well across care settings. This means it can be institution-based care, hospital, subacute, skilled, nursing home, residential. It works really well in ambulatory and primary care settings, and certainly it has a lot of impact in community-based organizations that are working to help older adults address what matters most in daily life. So let's switch gears now and think about age-friendly communities. And this is a different social movement, very important, but quite different from age-friendly health systems. So the World Health Organization really initiated age-friendly communities back in 2006. So this has been going on quite a long period of time. So the Global Network for Age-Friendly Cities and Communities is featured on this slide. Let's talk a little bit more about that now. World Health Organization defines an age-friendly community as a place that encourages active aging by optimizing opportunities for health, participation, and security in order to enhance quality of life as people age. The AARP, which is the U.S. representative for this World Health Organization movement, notes that age-friendly communities adapt their structures and services to be acceptable to and inclusive of older people with varying needs and capacities. I'd also like to give a very quick call out to the reference at the bottom of this slide, Better Together, a comparative analysis of age-friendly and dementia-friendly communities that was provided by AARP. So AARP is a U.S. affiliate for age-friendly communities, and the website to AARP's resources about being age-friendly are listed right here on the slide. This is a quote that comes out of the page that I'm going to show you in the next slide that I think is really interesting and very important. So the quote says, "The common thread among the enrolled communities and states is the belief that places where we live are more livable and better able to support people of all ages when local leaders commit to improving the quality of life for the very young, the very old, and everyone in between." So this is the website screenshot of the AARP Livable Communities. And the quote that I just read to you is there on the left-hand side. The more important visual aspect of this screenshot is how many livable communities, how many age-friendly states and communities there are across the United States, as illustrated in the picture on the right-hand side of the slide. So when we think about age-friendly and livable communities, age-friendly refers to livability for people of all ages, including older adults. There are 8 domains of livability: outdoor spaces, transportation, housing, social participation, respect and social inclusion, work and civic engagement, communication, and community and health services. This is another visual. Each one of those 8 aspects of being age-friendly are actually pictured here on this slide. I thought about trying to put what they are labels on each one of the photographs, but I think that if you look at it carefully, you can see how these things are all related to the 8 domains of being age-friendly in our communities. And AARP makes a very important point about being age-friendly is rooted in active aging, meaning we're helping people maintain function and engagement for as long as possible. So when we think about an age-friendly health system compared to an age-friendly community, there are some similarities and there are some important differences. So an age-friendly health system focuses on the person and the system of health care. And it really emphasizes doing what matters most to the older adult. Age-friendly communities, on the other hand, are more focused on population, providing environmental support for older adults and people of all ages. Both focus on maintaining function and independence. Both maximize physical, social, and mental well-being, and doing what matters, which is often linked to the larger environment, is really inherent in both health systems and community social movements. So let's switch gear now. We talked about age-friendly health systems. We've talked about a little bit about age-friendly communities. Let's move on now and talk about dementia-friendly communities. I'd like to say again, I don't have any date on this slide, but I think it's very important to understand that being dementia-friendly has been a social movement that started in Europe, particularly the United Kingdom, came into Canada, and then migrated, I think, into the United States. So there are lots of different social organizations and networks that support being dementia-friendly, and they all have wonderful resources and supportive materials to help you understand how simple changes can make a huge difference in an older person's ability to navigate in their community, feel respected, and have a better quality of life, although they may have dementia. So the Dementia Action Alliance is an important U.S. resource, Dementia Friends in the U.K., Alzheimer's Society in the U.K. and Canada. And we're going to talk particularly about Dementia-Friendly America in this section of the program. Dementia-Friendly America is based on Act on Alzheimer's that was evaluated throughout the state of Minnesota and is now sponsored by the National Association of Area Agencies on Aging. And the link is there. There are tremendously strong, wonderful supportive materials about being dementia-friendly at dementiafriendlyamerica.org. And I would also like to emphasize that Dementia Friendly America also sponsors Dementia Friends, which is another independent program that is related to being a dementia-friendly community, but is slightly different. So, what is a dementia-friendly community? There are lots of really interesting definitions out on the websites. As the previous slide emphasized, there are a wide variety of organizations that are working very hard to advance the social movement of being dementia-friendly to older adults who are experiencing dementia themselves, people who are living with dementia, but also their care partners, their family members, their friends, in helping those individuals as well feel supported. So let's just look at it a couple definitions. A dementia-friendly community understands that dementia can affect a person's cognition, but also their behavior, emotions, and their physical abilities. It embraces the belief that everyone has a role in recognizing people with dementia as part of their community and supporting the person's independence, their value, and their inclusion. Dementia-friendly communities increase awareness, promote social inclusion, challenge the stigma that is too often associated with dementia, and improves both care and services offered to those living with dementia. Dementia-friendly communities can be considered in a kind of graphic way, and this slide is taken from Dementia Friendly America, that the person living with dementia deserves well-being. We want their care partners to feel effective. We want both the care partner and the older person to feel supported and to have health. We want to address that through system capability, meaning best practice dementia care and supports in health, long-term care, and community services. We also think about the impact of the community itself, the town, the village, the city, the community surrounding the person who lives with dementia and their care partner. And we want to think about the adoption of dementia-friendly practices within and across all community sectors. And by a community sector, we're talking about the faith community, the business community, governmental services, and healthcare. So the 10 sectors of community engagement in being dementia-friendly are a lot like the ones that we saw for age-friendly communities: transportation, housing, services, businesses, legal and advanced planning, financial, neighbors and communities, independent living, faith communities, care services across the continuum, memory support services, and certainly emergency planning and first responders. So visually, this is a slide, again, borrowed from Dementia Friendly America. Visually, you think about our community and all of the sectors that an older person living with dementia and their care partner, their family member, may be out and about and interacting. So that could be in the faith community, that'd be going into the bank, it could be trying to buy something to eat in the restaurant. It could be as they live in an independent living program supported in the community. It could certainly be as they receive some kind of emergent care because of a healthcare crisis. So the idea here is that there are all these opportunities for services and community members to understand a bit about what dementia is, how it infects people, and how to respond to them in a supportive, caring, and helpful way that respects them as a human being and their participation, their full participation in community life. So in Dementia Friendly America, we think about developing an action team in the community. And again, the sectors, the community sectors, spin around the core of people that are going to be involved in thinking about how can we be more friendly to older people living with dementia and their care partners. So our action team always includes people living with dementia and their family caregivers, and then it includes representatives from community sectors that might include residential, legal, governmental, transportation, and certainly social service agencies and community members, as outlined on this slide. So when we think about dementia versus age-friendly communities, there's a lot of overlap in the goals and the approach. They both focus on maintaining function and being independent, doing as much as we can for as long as possible. They both focus on maximizing physical, social, and mental well-being among older adults. And they also emphasize the importance of broad stakeholder engagement, meaning that it really does take a village. So the idea is that it takes a lot of engagement, a lot of involvement, a lot of support, a lot of education, and time spent planning. So there's good, solid evidence that being age-friendly and dementia-friendly are very possible, very important, and can be achieved by holding hands and planning together. One caveat I think is important, and that is came out of, again, the comparative analysis of age and dementia-friendly communities that was published by AARP. And that is that a dementia-friendly community is age-friendly, but an age-friendly community isn't necessarily dementia friendly. So I think that as we think about how we might push ahead on our social movement, thinking about community engagement, that if we're going to advance being age-friendly, we might want to think about it articulating with also being dementia-friendly so that we can achieve the two in one set of work to help people really improve what they do to support older adults, those with and without dementia. So again, dementia and age-friendly, doing what matters is really the common theme. Support older adults to be successful, facilitate the social environment so that people are accepted and respected, facilitate what goes on in the physical environment so that they can move, travel, be safe, and really enjoy living. It involves acceptance, respect, and assistance as needed. But I think that the key word here really is respect. And then in age-friendly health systems, we want to think about the person's priorities as guiding care and decision-making. And throughout, we want to focus on the older person's strengths and abilities. And no matter which of our age-friendly or dementia-friendly social movements we think about, everyone has a role. So in summary, there are lots of wonderful opportunities to change societal attitudes, beliefs, and practices. We can do that in our healthcare systems, in every aspect, across settings from acute care to residential programs, and in community settings, from villages to cities. And we can support older people to live well by reducing unwanted care and burden. We can promote their function and independence, and certainly we can help make their life easier and certainly better quality. So I'd like to stop and say, everyone has a role. How about you? Thank you.